Hello all, I am Joni Sandgren, a registered nurse in the state of Florida. I am studying to be a nurse practitioner. Educating on healthy habits like exercising and preventing the spread of germs are part of a practitioner's routine education. For this presentation, I will be discussing the most recent evidence on the physiological effects of wearing face masks while exercising. In discussion among professionals like Darnell et al. 2020, Daugherty et al. 2021, and Epstein et al. 2022, expanded social distancing and wearing personal masks for personal protection from viruses is somewhat of a normal activity for healthy adults since 2020. Morris et al. 2020 and Sheen et al. 2021 report that there are many instances of clients being fearful of harmful effects from wearing masks while exercising. They say that clients reported feelings of anxiety, fears of harm, and some have reported foregoing daily exercise routines until more information about the subject is available. Eliminating exercise could cause an individual's health to decline, but this could also lead to diminished work productivity of a community and the country's further preventable healthcare spending, according to Daugherty 2021, Latit de Prado 2022, and Sheen et al. 2021. There will be 5 parts to this presentation. 1, I will discuss the PICO question about the topic. 2, the evidence and conclusions from the research, a proposed change in its process, an evaluation based on the data, and finally, a dissemination plan regarding the change. First, the PICO question. The question is, in adults aged 18 to 40, is the use of masks compared to no masks negatively impacting during exercise over the course of a recommended routine? According to the Centers for Disease Control in 2022, adults aged 18 to 24 are the most likely to meet the recommended daily aerobic exercise, and adults aged 24 to 40 are the second most likely. This is a rationale for the chosen population. The intervention is performing exercise with a mask. This is what people are hesitant to do because of fear of harm. The comparison or control is without a mask. This is the previously normal way to exercise. The outcomes are factors such as heart rate, oxygen saturation, rate of perceived exertion, and percutaneous carbon dioxide. The time frame for the question is over 30 minutes. The Center for Disease Control and Prevention in 2022 recommended aerobic exercise for 30 minutes a day for adults aged 18 to 40. In younger adults, aged 18 to 40, is the use of masks compared to no masks negatively impacting physiological factors during exercise over the course of a recommended exercise routine? Part 2, the evidence found to answer the PICO question. 41 relevant scholarly articles were found on this topic at the University of St. Augustine online library. After removing duplicates and eliminating others for reasons, 11 articles were focused on to answer the PICO question. Each of these articles was graded on the Johns Hopkins Evidence Scale. They were all a level 1, 2, or 3. These next 2 slides are an abbreviated version of evidence tables. They show the author, the article title and year of publication, the type of research and evidence grade, and some details of the studies performed, such as what kind of activity was performed, which physiological response was measured, and the number of participants. The conclusion of negative effects is also documented. Of all the articles, the common shared outcomes were heart rate, oxygen saturation, and perceived exertion. The type of aerobic activity varied amongst the articles. Some exercises were strictly cycling, some are strictly on a treadmill, some use a variety of exercise techniques. The intensity also varied. Aerobic activity was key, though, for determining the effects. At least 20 minutes of elevated heart rate activity. In these 11 articles, the conclusions drawn from the results could fit into one of 4 categories. Only one article concluded that wearing masks had negative physiological effects. The results of the study, though, were nearly the same as the other studies. The conclusions that the researchers drew from those results made this article stand out as reporting harmful effects. 3 of the 11 articles concluded that there were no negative effects. 5 of the 11 articles concluded that there were negative effects, but they were minimal and non-harmful. 2 of the 11 stated an inconclusive amount of data or further research is needed. All of the articles commented on the patient's feelings of discomfort. The conclusion I drew from the evidence was, while it is not ideal for comfort to exercise with a mask, the effects of foregoing exercise altogether would be more harmful than exercising masked for a time. But due to the demand for knowledge on this matter, more research studies should be underway. Continued education and inquiring is a must. Studies investigating the effects for an extended number of routines perhaps should be considered. More answers are needed, but for now, providers should tell their clients to keep on exercising even with masks. Part 3, Practice Changes. I will be using Berwick's model for change. Donald Berwick is the President Emeritus and Senior Fellow at the Institute for Healthcare Improvement. The steps in Berwick's model for change begin with establishing innovators and stakeholders, creating slack for change, then initiating buy-in, followed by leading by example, and finally evaluating and making changes. This is from the Institute for Healthcare Improvement in 2022. Step 1 is to establish innovators and stakeholders. The setting for change is in the primary care setting. The stakeholders are simply primary care providers and their clients aged 18 to 40 who are generally healthy. Perhaps the clients who already have an exercise regimen who have paused their exercising due to uncertainty. Part of creating slack for change is understanding the barriers and solutions for change. Berwick, in his article on change in 2003, states, the more uncertainty a subject for change embodies, the less likely for change to occur. Some barriers for change for wearing masks while exercising are: the evidence points towards no harm, but further research is needed. There is a polarity in the political climate regarding wearing masks regardless of exercising. And the evidence-based research does not include the comfort for clients. The solutions for these barriers are repetition and reinforcement with further knowledge, says Berwick in 2003. Understanding communication and empathy from McGinn in 2022, and assessing the report of comfort and discomfort for each client for wearing masks while exercising. Step 4 is leading by example. This one's so easy. When I exercise, I'll wear my mask, and when I teach my clients, I'll tell them to do so as well. Step 5 is to evaluate and adapt. Staying up to date with the most recent information is available through national organizations like the Institute for Healthcare Improvement and the Agency for Healthcare Research and Quality. Part 4 is the evaluation of evidence. Outcomes for this study are measured in oxygenation, heart rate, percutaneous carbon dioxide, and the rate of perceived exertion. These numbers are continuous and not binary. The sample population were the same for both masked and unmasked studies. Data collection tools are heart monitors, O2 sat, and CO2 monitors, and the client's reports of feelings of exertion and performance. The difference in heart rate, oxygen saturation, and percutaneous carbon dioxide are each measured in different units. Each will be measured separately compared to the control and then evaluated. The statistical test to be used in the evaluation would be a paired sample t-test. On the left is the paired sample t-test formula where the D is difference per paired value and the N is the number of samples. On the right is the D difference per paired value. The answer will tell you the difference between the two groups, both masked and unmasked. Part 5 is dissemination of the change. Healthcare is rich in evidence-based innovations, yet even when such innovations are implemented successfully in one location, they often disseminate slowly. if at all. Diffusion of innovations is a major challenge in all industries among healthcare, says Berwick in 2003. A modality for disseminating the material institutionally would be at peer meetings or weekly huddles. Organizations like NACHO contribute its work to promoting healthcare education locally, and its venue should be considered for local disseminating. Regional and national electronic dissemination can be done through the CDC, the Institute of Medicine, and AHRQ. Publication venues to be considered are with organizations like American Nurses Association or the National League for Nursing. Being a member of these organizations contributes to the influence as described from the University of Buffalo in 2022. In conclusion, 1. The PICO question asked if masks were harmful to adults while exercising. 2. Evidence was discussed and evaluated for best practice. 3. Using Berwick's model for change, a step-by-step approach was discussed to implement change. 4. An evaluation of evidence was discussed along with the criteria, outcome, and tools to measure. 5. Methods for dissemination on the material on the local, regional, and national level were discussed. I am open to questions in the comment box and I invite your feedback. Thank you.